Planned Parenthood closes 5 clinics after funding cut. What you need to know. Imagine a world where access to basic healthcare, including reproductive services, is stripped away from thousands of people in need. This is the harsh reality that has unfolded in Northern California, where Planned Parenthood has been forced to shut down 5 clinics due to drastic funding cuts triggered by President Donald Trump's massive tax bill. The nonprofit's largest affiliate, Planned Parenthood Mar Monte, which serves Northern California, the Central Coast, and Nevada, has made the difficult decision to close its clinics in South San Francisco, San Mateo, Santa Cruz, Gilroy, and Madera. But here's where it gets controversial. The move is a direct result of the Trump administration's efforts to defund Planned Parenthood, which has been at the center of a heated debate over reproductive rights. The organization has cited a loss of federal funding as the primary reason for the closures, which will affect over 22,000 patients who rely on these clinics for portable health care. And this is the part that most people miss. The new tax bill not only cuts funding for healthcare, but also prohibits organizations that perform abortions and receive more than $800,000 in Medicaid reimbursements annually from recouping that money. Planned Parenthood Mar Monte has stated that the bill is prohibiting Medicaid reimbursements to healthcare organizations that exactly match the description of Planned Parenthood. The organization has long relied on Medicaid reimbursements to provide essential services, including STI testing, cancer screenings, and prenatal care to low-income patients. In fact, about 80% of patients across its 35 clinics rely on Medicaid, and the organization receives approximately $100 million. Half of its annual revenue through federal reimbursements. The closures have sparked outrage among local leaders, with Representative Kevin Mullen, D. San Mateo, stating that the problem isn't the mood is a result of shameful extremism embodied by the Republican House majority. Assemblymember Diane Pappan, D. San Mateo, has also weighed in, warning that the closures will have devastating consequences for women's health, including reduced access to pap smears, mammograms, and prenatal care. But what's often overlooked in this debate is the human impact of these policy decisions. The patients who rely on these clinics are not just statistics. They are real people who will be forced to go without essential healthcare services. So we have to ask, what's the true cost of defunding Planned Parenthood? Is it worth the political gain? Or will it ultimately harm the very people it's supposed to serve? The answer to this question is complex and multifaceted, and it's one that we should be discussing openly and honestly. As the legal challenge to the budget bill makes its way through the courts, one thing is clear. The fate of reproductive health care in America hangs in the balance. Will you join the conversation and share your thoughts on this critical issue?